Have you ever wondered, is masturbation after 60 good for your health, or is it a habit you should give up? You've probably heard someone say, after 60, men should forget about that. But is that really true? Masturbation in men over 60 is something most older men still do, but no one dares to talk about. Some say it helps maintain testosterone, improves sleep, and keeps your manhood from becoming lazy. Others claim it's the reason men become weaker, physically and mentally. So, what does medical science really say? Should you keep doing it or stop? And where is the line between a habit that boosts senior health and one that may accelerate your decline after 60? I'm Dr. Emily Carter, a physician specializing in male sexual health with over 20 years of clinical experience in the U.S. In today's video, we'll uncover 10 science-backed benefits of masturbation after 60 to 10 hidden risks that few people talk about, and most importantly, clear medical advice with no moral judgment, no shaming. This is a video you simply can't afford to miss. If you've ever asked yourself, am I doing the right thing for my sexual health and natural testosterone at my age? Then this is where you'll find your answer. Before we dive in, I'd love to hear your thoughts. What do you think about masturbation after 60? Drop a respectful, honest comment below. And let's have a science-based conversation. Here's a truth most men will never admit. The majority of men over 60 still masturbate. But they never talk about it. Not with their wife, not with their kids, not even with their doctor. According to the Journal of the American Medical Association, 70% of men over 60 remain sexually active. Yet the majority stay silent. In over 2 decades of patient consultations, I've had countless older men, from war veterans to retired CEOs, whisper the same question. Doctor, is it normal to masturbate at my age? And you know what? They ask with worried eyes, like it's something shameful. Because society has convinced them that after 60, sexuality no longer matters, that if you still have desires, you're being inappropriate. But what's the truth? Masturbation after 60 is not a sin. It's part of sexual health for men over 60, a vital topic that's been buried under stigma, shame, and lack of medical awareness. So today, we're wiping away the dust. We're calling it what it is, using science, understanding, and respect for our aging bodies. Because senior male wellness isn't just about blood pressure, heart health, or joints. It's also about erectile health, natural testosterone, and that quiet confidence only a man can understand. This is the part that you've been waiting for. If you've ever wondered, at this age, does masturbation still serve any purpose? Here are 10 science-backed reasons proving that it's not just good, it's necessary. Benefit No. 1. Maintain natural erections. Once you reach your 60s, blood flow to the penis gradually declines. Without regular sexual activity or physical stimulation, you risk corporal tissue atrophy, meaning permanent loss of erectile function. According to the Urology Journal, 2015, men over 60 who ejaculate 1 to 2 times per week reduce their risk of erectile dysfunction by 39.6% compared to sexually inactive peers. Masturbation, if done correctly, acts as a workout for your penis. Benefit No. 2. Boost natural testosterone. Here's an overlooked truth. Sexual stimulation triggers a temporary rise in endogenous testosterone, even in older adults. A study by Harvard Medical School found that testosterone levels can increase by 10 to 15% after each ejaculation, particularly in men with naturally lower baseline levels. If you're feeling fatigued or experiencing low libido, this is a safe, drug-free way to activate your hormones. Benefit No. 3. Improve sleep and reduce stress. Ever notice how you sleep better after masturbating? That's due to the release of prolactin and oxytocin, hormones that calm the nervous system. Research in the International Journal of Impotence Research, 2018, reported that 70% of men over 60 experienced better sleep quality after achieving orgasm, whether through sex or masturbation. Benefit number 4. Lower prostate cancer risk. This may surprise you. Regular ejaculation helps cleanse the prostate from within. A long-term study from Harvard University tracked 31,925 men over 18 years and found that those who ejaculated 21 plus times per month had a 33% lower risk of prostate cancer than those who ejaculated 4 or fewer times per month. If regular intercourse isn't happening, masturbation is a clean, effective alternative for maintaining prostate health. Benefit number 5. Keep testes and hormones active. Masturbation isn't just a surface-level act. When you stimulate your body, the testes are triggered to keep producing sperm and hormones. This helps delay hormonal aging and supports fertility, if that's still desired. It also maintains the function of the HPG axis, hypothalamus, pituitary gonadal, which tends to decline after age 60. Benefit number 6. Improve ejaculation control. Masturbation, when used as a training technique, helps men gain control over ejaculation. Techniques like start, stop, and squeeze methods have been shown in the Journal of Sex Research, 2012, to reduce premature ejaculation by up to 65% when practiced consistently. Benefit 7. Relieve chronic pelvic pain syndrome, CPPS. Many middle-aged and older men suffer from CPPS, chronic pelvic pain syndrome, characterized by persistent perineal pain without clear cause. Gentle ejaculation can relieve pelvic muscle tension and soothe nerves in that region. A survey published in European Urology, 2016, found that 54% of CPPS patients reported symptom relief after natural ejaculation. Benefit number 8. Prevents penile cavernous muscle atrophy. If you don't experience regular erections, blood flow to the penis becomes restricted. Erectile tissue begins to harden, fibrosis, leading to permanent erectile dysfunction. According to the Journal of Sexual Medicine, 2016, men over 60 should maintain at least 2 erections per week, including through masturbation, to preserve erectile tissue function. Benefit number 9. Helps monitor cardiovascular health indirectly. Your ability to achieve an erection is one of the most sensitive indicators of cardiovascular health. If you used to get erections during masturbation, but suddenly lose that ability, it may not just be a sexual problem. Cleveland Clinic reports that over 70% of erectile dysfunction cases in older men are early signs of atherosclerosis or undiagnosed coronary artery disease. In other words, a behavior you may consider private is actually a powerful marker of vascular health. Benefit number 10. Maintains confidence and masculinity. Last, but incredibly important, maintaining your sexual function, even through self-stimulation, is a powerful source of psychological resilience. A study from the American Psychological Association found that men over 60 who remained sexually active, even independently, had 27% lower risk of depression, 22% lower cortisol levels, the stress hormone, higher self-rated scores on overall health compared to those with no sexual activity. So, as you can see, masturbation after 60 is nothing to be ashamed of. When practiced responsibly, it's a key part of sexual health for men over 60, just like your cardio workouts or routine blood pressure checks. But don't be too quick to celebrate, because in the next section, I'll reveal 10 hidden dangers of masturbation after 60. And some of them may genuinely surprise you. You've likely heard plenty about the benefits of masturbation in older age, but it's time to pause, because everything in excess has consequences. And from a medical standpoint, there are at least 10 real drawbacks of masturbation after 60 that most men don't realize until it's too late. 1. Reduced natural testosterone from overfrequency. A 2021 study in the Journal of Urology found that men over 60 who masturbated more than 3 times per week had 12% lower serum testosterone compared to those who did so once a week. Too much stimulation, pituitary gland dysfunction, gradual drop in natural testosterone production. 2. Loss of sensitivity and difficulty reaching orgasm. During real sex, the International Society for Sexual Medicine, 2019, reported that excessive or aggressive hand stimulation can cause penile desensitization, especially at the glands. The result? In real intimacy, the penis may no longer respond normally or require far more effort to achieve climax. 3. Chronic fatigue and low morning energy. Men over 60 already have declining hormone levels. If you masturbate before bed or immediately upon waking, your body misses out on the natural dopamine and oxytocin surge, leading to sluggish mornings and reduced vitality. According to the Sleep Foundation, 2020, frequent nighttime masturbation is linked to poorer sleep quality in older men. 4. Increased risk of erectile dysfunction due to dependency on unrealistic stimulation. Even without watching pornography, many men still rely on imaginary or unrealistic sexual positions during self-pleasure. This leads to sexual conditioning, which trains your brain to respond poorly during real-life intimacy. According to European Urology Review, 2018, 27% of men over 60 reported being unable to maintain an erection with their partner, even though they could still climax during masturbation. 5. Worsens benign prostatic hyperplasia, BPH. A study from Harvard Medical School found that frequent ejaculation in men with BPH can irritate the enlarged prostate tissues, causing increased urgency, nighttime urination, and even perineal pain. If you're undergoing BPH treatment, unregulated masturbation may reduce its effectiveness. 6. Triggers dopamine imbalance, leading to chronic anxiety. Excessive masturbation causes repeated dopamine spikes, creating artificial pleasure peaks. Over time, your brain adapts to these highs, making it harder to feel satisfied with normal daily life. Neuropsychopharmacology Reports, 2017, found that men over 60 with compulsive sexual behavior had 18% higher cortisol levels, a key indicator of hidden stress. 7. May cause inflammation of the foreskin or penile skin. The genital skin becomes drier and less elastic with age. Without proper lubrication or technique, masturbation can lead to inflammation, skin irritation, or swelling. A study from UCLA Health, 2019, reported that 14% of men over 60 visited clinics due to penile dermatitis caused by excessive mechanical stimulation. 8. Reduces emotional intimacy with partner. Masturbation is a solo act. If it becomes a regular substitute for real emotional and physical connection, it can weaken relationships, lower shared dopamine release, and erode emotional bonding. A survey by AARP, American Association of Retired Persons, of 1,200 couples aged 60 plus, revealed that 32% of husbands who masturbated frequently lost interest in affectionate interaction with their wives. 9. Reinforces addictive behavior, harder emotional control. When the brain builds a reward loop around masturbation, it can lead to mild behavioral addiction, especially if you live alone. This makes it harder to regulate emotions, leading to irritability and impatience. The Behavioral Neuroscience Journal, 2020, confirmed that repetitive sexual behavior activates the same brain areas as sugar and caffeine addiction. 10. Masks warning signs of serious medical conditions. If you masturbate and notice numbness, discolored semen, painful ejaculation, or blood, these symptoms may not just be age-related. They could signal issues like prostatitis, testicular cancer, or genitourinary nerve disorders. Ignoring them with the thought, "I'm just getting old," may cost you the chance for early diagnosis. The most important message I want you to remember is this: masturbation isn't harmful. Uninformed masturbation is. When you regulate frequency, understand your body, and stay alert to unusual symptoms, you're protecting your sexual health after 60 in a way that's both safe and empowered. So, if you're a man over 60, what should you do? My advice isn't simply about saying you should or should not masturbate. It's about this: how can it become a healthy part of your healthy aging for men journey, instead of becoming a silent burden? First, listen to your body. If you masturbate 1 to 3 times per week, feel relaxed, sleep well, have an improved mood, and don't feel guilt or obsession, then that's a positive sign. A 2019 study published in the International Journal of Urology found that men over 60 who ejaculated 2 to 4 times per month had a 23% lower risk of prostate cancer compared to those who ejaculated less than once a month. Second, place it in the bigger picture of your sexual health. If you're having difficulty reaching orgasm or notice your erections don't last as long as they used to, it may be time to get your testosterone levels checked. A 2017 study in the Journal of Clinical Endocrinology and Metabolism revealed that up to 39% of men over 60 have low testosterone, but many go undiagnosed. Third, avoid unconscious overuse. If you find yourself masturbating out of boredom, stress, or loneliness, take a pause. Not because it's wrong, but because you may be using it as a form of avoidance. In such cases, I often advise patients to add physical activity, like a 20-minute daily walk, or meditation to shift the coping mechanism. Finally, never hesitate to talk to your doctor. We don't judge you. We're here to help you maintain your sexual health for men over 60, which is just as important as heart health or blood sugar levels. Remember, you have the right to feel desire and the right to feel fulfilled, whether you're 30 or 70. Sexual health has no age limit, only a knowledge gap. As you can see, masturbation after 60 isn't a topic to avoid. It's a natural and even beneficial part of life, if understood and practiced correctly. We've just gone through 10 science-backed benefits, 10 often overlooked risks, and real-world advice to help you approach your sexual health for men over 60, healthily and proactively. If there's one message I want you to take away from this video, it's this. Age does not have the right to steal your instincts, emotions, or desires. But you do have the power to choose a wiser approach, transforming masturbation after 60 into a supportive part of your male vitality and healthy aging for men, instead of something you hide or silently fear. Now, I'd love to hear from you. Are you facing changes in your physical or sexual health after 60? Do you feel this topic is still misunderstood in society? Share your thoughts in the comments, because your story may help someone else feel less alone. And if you found this video helpful, don't forget to hit subscribe so you won't miss future deep dive topics on erectile health, testosterone after 60, and natural male vitality. We're here to walk this path with you. No judgment, no shame, just science and real understanding.